Good morning, everyone, and welcome. My name is Paul Schemmel. I'm a state representative from Franklin County. So delighted to be here today. A little over 20 years ago in my law office, we had a request from the pregnancy center in our county seat of Chambersburg. We had a small office that we used for appointments in a small town in the southern part of our county. And the pregnancy center was looking for a place where they could, from time to time on appointment, meet with clients. So when I presented this to my fellow partners, I said, can we let them use this space by appointment just for no charge? This is a great service. And we were so delighted to do that. But by appointment became every Monday morning, which became every Monday, and then every Tuesday, and every Wednesday. And what was at first just a use by appointment from now and then became almost a full service office, which we were delighted to provide to the Pregnancy Resource Center. Until finally they said, we have enough clients, we have enough individuals, enough women that are really needing help that they needed a full-time office of their own. And they were able to move into that, so they had plenty of room. And I can't tell you now, over 20 years later, how exciting it is for us in the law office to have people come to get their will done, to have a deed done, things like that, and say, I was here over 20 years ago, and I faced a very difficult decision. And the caring people at the pregnancy center that was meeting in your office helped me to see a way forward. And then they'll show us, and this is a picture of my son today. He just graduated high school. Or this is a picture of my daughter. She's getting married this summer. Now I can tell you not everyone has positive experiences in a law office, so that's pretty exciting. And very few people have positive experiences in a law office that are free. So that's a delight to us to be able to have offered those opportunities. But it also shows you how life-affirming pregnancy centers are and how much of an asset they are to all of our communities. So I'm delighted to welcome everyone here today to hear what pregnancy centers are and what they aren't from the very people that run these services. And next, I'm glad to introduce to you the minority member of the House of Representatives, Brian Cutler.
Thank you, Paul. Good morning, everybody, and I want to thank PPWC and Representative Schemmel for organizing this event. More importantly, this association of pregnancy and really those wellness centers is new and necessary. And that is because these community support institutions are under direct assault from some leaders in state government, leaders who do not believe that protecting reproductive rights also means protecting the right to life and to offering a real alternative instead of just a false choice. Let me tell you a little bit about what these organizations do and what I have personally witnessed in Lancaster. Because many know they can go to these organizations for pregnancy confirmation, but that really is just the beginning of their story. Very similar as Representative Schemmel laid out. They support families, mothers, fathers, and children from conception through familyhood. They provide diapers, and many in hundreds of thousands of each year. They provide formula, they provide cribs and furniture, books and toys. They provide parenting classes, connect struggling families with state resources and benefits, help them find housing within their communities, and work to keep families together by keeping them supported. Many times, these organizations are the very first people to help those families in our communities who are unseen. The poor, the mentally ill, the refugees, and those with very complex histories. Many of the clients do not speak English. All of them are just looking for a little bit of help. A little help to do what is in their hearts and what is dear to us, keep and raise families. These organizations sound like something that the state should be supporting. They take the burden off of taxpayers by providing services in the place of families being in a broken welfare system. Their early intervention in family life keeps families together, and it keeps children out of the system in the future. Unfortunately, there are too many who simply want to close the doors of these facilities through slander, inaccuracies, and spin driven by an industry that does not support life and wants families in need to make that false choice between an abortion or nothing. These organizations have been the target here in Pennsylvania. Not only have they had their funding cut, but the state also has continued to make it more difficult for these very same organizations to provide services to their clients who so desperately need them, pushing them directly into state assistance. That's not just an attack on pregnancy and family life centers, but it's an attack on the clients they serve, the poor, the mentally ill, refugees, and those simply seeking some help. Over the coming weeks, whether we like it or not, it is clear we're going to have a decision in this building about reproductive rights and life and what it means here in Pennsylvania. But that conversation just evolves into political talking points too many times. It does not really include a full discussion and a meaningful discussion on what it means to have the right to life, about how we can help organizations that make life in a family easier and possible while also benefiting taxpayers. How we can help support mothers, fathers, children, caregivers, guardians, regardless of whether they began their journey with IVF, adoption, fostering, or any of the many ways that families can truly come together. That's the real conversation, the two-way conversation that we have to have. And I want to thank Representative Schemmel and PPWC for leading the way in having the opportunity to have a full and robust discussion. Thank you to the organizations. I want to thank the volunteers, many of who are behind us, and the employees. And most importantly, I want to thank the families who are seeking help in these situations, and that those who continue to speak out on behalf of the great work and the family support that these support centers provide. I'll now introduce Sarah Bowen.
Thank you, Representative Cutler. My name is Sarah Bowen, and I am the founding president of the Pennsylvania Pregnancy Wellness Collaborative. Thank you all for being here this morning. Thank you for coming out to hear about this amazing work that is being done right here in our own backyard. The PPWC is a collaborative of pregnancy centers across the Commonwealth of Pennsylvania. We are designed to unify and represent pregnancy medical clinics and resource centers as they work to advance maternal and child health care through free and low-cost services to any individual in need in our Commonwealth. The Pennsylvania Pregnancy Wellness Collaborative represents pregnancy centers located in health deserts, low-income communities, small towns, large cities, college areas, and many other types of communities across our Commonwealth. Wherever women and children are in need, you will find pregnancy centers. And they will be working hard to ensure that women have access to the help that they need to make informed choices. The PPWC is proud to represent these vital health services to our legislature and to our communities. In a moment, you will hear from some more people about the amazing work that pregnancy medical clinics and resource centers do in Pennsylvania. As you listen, I don't want you to think about us. I want you to think about the women and the children and the men that we're able to help. I don't want you to think about the organizations. I want you to think about the people who make up those organizations. I don't want you to think about the politics. I want you to think about the people, because that's what pregnancy centers do every day. Every day, today included, women and men and children are receiving free and low-cost services all across our state. The PPWC exists to represent these medical clinics and resource centers, and by extension, the individuals that they serve. Thank you for being here on this historic day, the first day of advocacy that pregnancy centers have had here in Harrisburg. Thank you for being here as we launch this collaborative and we make sure that pregnancy centers have the help that they need to serve those most in need across the state of Pennsylvania. Right now, I'd like to introduce Representative Katie Klunk, co-chair for the Pro-Life Caucus.
Thank you and good morning. I'm State Representative Kate Klunk. I represent the 169th District in Southern York County. I am one of our co-chairs of the House Pro-Life Caucus, along with my co-chair, Chairwoman Kathy Rapp, who also joins us here today. I truly appreciate the opportunity to say a few words that highlight the very important role that our pregnancy resource centers, our pregnancy medical clinics, and the Pennsylvania Pregnancy Wellness Collaborative play here in Pennsylvania. These organizations not only advocate for life, but truly offer transformative resources for moms, dads, babies, and families. Last June, Representative Schemmel and I joined forces to host a policy committee hearing about our pregnancy resource centers. The testimony that we heard from the families and service providers that day was absolutely powerful and made it abundantly clear that these centers do a world of good here in Pennsylvania. In addition to serving families through free prenatal testing and medical procedures, pregnancy resource centers also offer education in the form of parenting classes, counseling services, and material resources like diapers and formula for our new parents. The people who staff these centers truly go above and beyond to aid and encourage our Pennsylvania families. The impact of these centers can be seen way long after the baby is born, across multiple generations, making their work truly unique and special. Pregnancy resource centers provide something that everyone can benefit from, whether in a crisis pregnancy circumstance or not, and should be widely recognized for that critical work that they do. The PPWC realizes this value and is working collaboratively to make pregnancy and parenting resources more accessible to our moms and dads so we can build stronger families right here in Pennsylvania. One of the most rewarding experiences in my lifetime has been becoming a parent. As the mother of 2 daughters, it is important to me that we ensure that all parents here in Pennsylvania receive the care and the support that they need to approach parenthood. My husband and I, we are blessed to have the financial stability as well as the support of our family and friends. But I know that many here in Pennsylvania are not as fortunate. Pregnancy resource centers, they step in to aid those in need with the help that they deserve. And now the PPWC is elevating these voices across Pennsylvania here in Harrisburg about the conversation regarding families and parenting. I truly agree with former Democrat Governor Bob Casey, who once said that pregnancy resource centers and the services that they provide help to fight the poison of hopelessness with love. I've seen that love at my local Tender Care Pregnancy Center in Hanover, and today it's incredible to see so many thriving resources available to our families right here in Pennsylvania. The work that the PPWC and its member organizations do for our moms, dads, and babies is truly outstanding. The organization has accomplished so much in its first year. Prior to the creation of the PPWC, each pregnancy resource center advocated on its own. Now they come together collaboratively with one unified voice for our moms, dads, and babies. The PPWC's advocacy is absolutely essential in extending the reach of our pregnancy resource and pregnancy medical clinics that are transforming lives one day at a time. I truly thank you for the opportunity to say a few words, and it's great to stand along so many fierce advocates who are making a positive impact here in Pennsylvania for our families. We still have much work to do to support our moms, our dads, and our babies. And I truly look forward to working with my Republican and Democrat colleagues, as well as Governor Shapiro, to ensure that these outstanding resources receive the support that they so very much deserve, so that they can support our best resource here in Pennsylvania, our people. Thank you. And with that, I will be introducing our next speaker, Brooke Neerman.
Hello, I'm Brooke Neerman, Executive Director of Alpha Care in Philadelphia. Happy to be here today. Unfortunately, in my home city of Philadelphia, both maternal and fetal health outcomes are really in a crisis state. The good news is that pregnancy medical clinics such as AlphaCare serve as a valuable community asset. Embedded in our own communities, pregnancy medical clinics are essential bridges, able to earn the trust of patients, provide imminent care and information to expedite their road into continued medical services. Pregnancy medical clinics are often a woman's first medical appointment. Under the guidance of medical directors, our medical staff, including nurses, ultrasonographers, provide pregnancy tests, early diagnostic ultrasound scans. Some provide STI testing and treatment, among other services. The other advantage is that pregnancy medical clinics provide additional support, including internal resources and helping clients navigate the external resources that exist. In my home city of Philadelphia, there's a lot of resources for pregnant women that people just don't know how to access or that they're available. The community support and the relationships that we provide are really essential in someone's health journey along the way, particularly through pregnancy and postpartum. We know women feel empowered when they're given truthful information, are aware of the resources available for them, and given the space and opportunity to truly make a decision for themselves about their pregnancy. Pregnancy medical clinics are essential to Pennsylvania's health landscape, and we have the local community support already from where we work, and we need the support of our legislators on both sides of the aisle to address the maternal health crisis here in our state. I'd like to introduce AlphaCare's board chairman, Mr. Charles Hopkins.
Morning. Be fairly brief, but I was born, like many other people in my community in the 90s, to two parents that were suffering from drug addiction. And fortunately for me, in my life, I had a support system, or what some of us might call a village. I had a grandfather and a grandmother, I had aunts and uncles, and a lot of people that could support me and my sister and my parents through what could have been a troubling time for us, financially, physically, emotionally. Other people don't have the same advantages that I had in life, and I'm really grateful for AlphaCare and all the pregnancy resource centers that are out there looking for parents like mine that need support. And I just wanted to say, in front of everyone here that what the work that AlphaCare does is so meaningful to me because I can see myself in those kids or in that parent, but I can also see the work that they're doing and how important it is to those families that don't have a village. Whether it's a mother that needs temporary housing and connecting them with those resources, or looking at ways to support them financially with connecting them to potential donors or people that are on our board, or even finding people like me who, when I was asked for Brooke to join the organization this way, to come support from a business acumen perspective and potentially even mentor women and fathers through financial issues or things of that nature. All of which I think is really important and is a really driver for why I remain involved with AlphaCare, especially as a board chair. So thank you, and I will pass it to Vice President of PPWC, Amy Sharon.
Well, thanks so much, and I just want to give a shout out here to everybody on the stage because we've got some clients and their children are up here and are tremendous representatives that are advocates for us in this state, and I just really appreciate all of you being here along with our staff and our volunteers. My name's Amy Sharing, and I am from the western part of the state, from Pittsburgh, and from Women's Choice Network. And the PA Pregnancy Wellness Collaborative, the PPWC, it represents centers from across the Commonwealth, as we've heard, and many of them are medical, as Brooke just described, but many more are pregnancy resource centers. These community-based nonprofits provide care and resources to assist women with immediate and ongoing needs related to her unexpected pregnancy. The women who visit our centers often face very complex and challenging circumstances, and an unexpected pregnancy adds even greater stress. But in nearly 40 years of service in this area, I've seen firsthand that abortion is not the remedy to her circumstance. When we address the context and begin to care for her unique challenges, she is free then to make a choice for life. As a matter of fact, in a recent study, 60% of post-abortive women said that they would have carried to term if they had had adequate help and support. And that's just exactly what we do. PRCs are powerful community partners, equipping and resourcing young families with essential long-term care. They serve vulnerable populations, as we've heard. And they provide pregnancy testing, parenting education, material assistance, education that promotes healthy sexuality, post-abortion recovery, men's ministry, referrals for medical care, and linkages to local community public health resources. These are vital. Personalized care is provided at no cost with a respectful, compassionate, and supportive environment by trained staff. PRCs adopt a holistic health paradigm. They take into account the emotional, social, mental, spiritual, as well as physical health. By providing practical assistance and these vital links needed, pregnancy resource centers improve health outcomes, and they promote health and well-being for themselves and their children and their families. I appreciate everyone who's been supportive today, and it's my pleasure to introduce from the 9th Legislative District in Lawrence County, and a member of the Health Committee, Representative Marla Brown. Marla?
Thank you so much. I'm so proud to advocate for the Pennsylvania Pregnancy Wellness Collaborative. And I'm blessed that Sarah Bowen, its director, actually is from my district, in District 9, so I know the good work that she does and where her heart is. We should absolutely be celebrating the invaluable work of these pregnancy centers, but also noting the critical importance of a unified voice in ensuring the wellness of Pennsylvania's mothers-to-be. Pregnancy centers are truly the unsung heroes of our communities. I know this well because I used to run one. They provide support and guidance for women who face the uncertainties and challenges of pregnancy. These centers offer comprehensive services including counseling, prenatal care, educational resources, and material services, all tailored to meet the needs of the individual and meet the woman where she's at in her situation. In addition, they truly empower women to make informed decisions about their health and the health of their unborn children. But the significance of these pregnancy centers extends far beyond the services they provide. They truly serve as pillars of strength and compassion, offering a safe haven for women in times of such vulnerability. They offer hope, demonstrating that no woman should ever feel alone or unsupported during one of the most life-changing experiences in their life. Despite their solid contribution, pregnancy centers often operate in isolation, facing challenges in funding, resource allocation, and unfortunately, public perception. This is where the power of unity becomes paramount, and what we're doing here today. By joining forces such as the Pennsylvania Pregnancy Wellness Coalition, these centers can increase their impact, advocate for shared resources, and encourage a collective voice that cannot be ignored any longer. I want all stakeholders, policymakers, healthcare providers, community leaders, and concerned citizens to recognize the role of pregnancy centers and the urgent role that they play in our society today. I urge you to stand with us, to lend support, and to champion the cause of maternal wellness across Pennsylvania. Together we can break down barriers, cut through the stigma, and ensure that every woman receives the care and support she deserves throughout her pregnancy journey. Together we can build a brighter, healthier future for mothers and children. There's no one else offering this type of support. Let us remember the strength of our voices lies in our commitment to the well-being of our communities. Let us stand united in our goal to support, empower, and uplift expectant mothers across Pennsylvania. It's now my pleasure to introduce the Chair of Maternal and Infant Health Caucus, Senator Judy Ward.
Good morning. I'm so honored and pleased to be here today. We have the stars of the show here. That's awesome. But it's great to just be here to raise awareness and highlight the life-saving work that pregnancy resource centers do. Every day across America and across Pennsylvania, pregnancy resource centers offer help and hope to women who feel alone, confused, and with nowhere else to go. When these women are in desperate search of answers and guidance on how to handle and care for their pregnancy, these centers step into that space and welcome women with open arms. The services they offer are often free of charge to empower the women who receive them to choose the best path forward for them and their baby. As chair of the Senate Maternal Infant Health Caucus, I was blessed to see the impact these centers have firsthand. Our caucus went across the state to several centers, joined by Republicans and Democrats, House and Senate members, to tour their facilities and hear from women about how their lives have been changed because of the aid and service that these centers have provided them. The stories we heard were just unbelievable. Because of the work these centers do, the women we spoke to were able to get the support they needed to give themselves and their babies the best future possible. This better future just doesn't stop with their child. These centers create generational impact. These healthy babies that are born to healthy mothers grow up and now offer the same safety, comfort, and care that that pregnancy center provided to their mother, to their children. All this amazing work adds up to lives saved. Since the mid-90s, pregnancy centers across the state have helped to lower the infant mortality rate from 7.3 deaths per 1,000 births to 5.5. This is no accident. Apart from the maternal assistance, education, and counseling provided to pregnant women, these centers work diligently with licensed healthcare providers to ensure that the women they serve and their babies get the medical care that they need. Clients of pregnancy resource centers have higher prenatal care rates, pediatric care rates, and immunization rates. And this regular medical care leads to higher infant birth weights and lower infant mortality. Their job is not done, though. These work that the centers do continues. Hundreds and thousands of women have been served by these centers, and so many depend on them every day. Their mission of supporting pregnant women and their babies and reducing the maternal and infant mortality rate in Pennsylvania is a cause that we all can share. My colleagues here today and I stand firm in the support of the inspiring work of pregnancy resource centers. We call on our colleagues from both sides of the aisle and across the building to join us in pregnancy centers, their life-saving mission. And I want to just do a special shout out and thank you to all concerned for all the things that you do to help the women in our and families in our Commonwealth. Next, I would like to introduce like to introduce Senator Scott Martin, who is here. He is the Appropriations Chair in the Senate. Senator Martin.
Good morning, everybody. First, I'd like to start off by when you see the men and women on this stage and their commitment to providing the love and support in our communities all across the Commonwealth that's just so needed. You're doing such amazing work. And the reason, what I wanted to talk, you're going to hear a lot about statistics today. You're going to hear a lot of different stories. But I really just want you to think about a situation, whether it's a son or daughter, whether it's a friend down the street who finds themselves pregnant, doesn't know what to do, doesn't know where to turn, thinks there's no hope, no options, questions what this is going to do and mean for their future. And imagine a place where you can walk in the door and find good counsel, find good health advice, find support throughout your pregnancy, get your questions answered, find support after the baby is born. Imagine a place that also focuses on getting fathers involved, keeping them involved, the importance of that, and what that means not only to them as individuals in that couple, but to the future of the baby. This is happening in neighborhoods all across this Commonwealth. And for anyone who ever has a chance, and I would encourage everyone, for many different reasons, to know what this resource is in your community, to walk in and see the faces of love that want to help these folks, help these children, to walk in these facilities and see the medical equipment that's available there to provide services, and the information that's there. One of my favorite is to walk into a room and just see untold shelves of baby formula, diapers, blankets, little odds and ends that are there, all meant to support the health, well-being of that child and that family. It's something you don't forget when you walk out that door. They also spend their time not only loving these kids and these families, but also out in the community trying to raise resources to support their own mission. It's incredible. So wherever you're at in Pennsylvania, I would encourage everyone, and we're trying to get other people to come and see the love and the support that's happening in all these facilities. We recently got a commitment by the Secretary of Health and Human Services, Valar Kush, to come and tour. I've already put it out, and Governor, its offer still stands, to come a couple blocks down away from the governor's mansion and visit one of these facilities and see what the ultimate spirit of loving your neighbor, caring about the future of our children, what it really means. This is a small sample of it, and it's happening every day across our Commonwealth. There are folks who want to support our mothers, our fathers, and most importantly, the future Pennsylvanians that you see before you. So God bless you all. Thank you for the work that you do, and let's all do our part to make sure that you keep loving and supporting each other. Thank you.
Hi everyone, I am Melanie Winter. I'm a board certified women's health nurse practitioner. I have a background in OBGYN and GYN oncology as both a registered nurse and a nurse practitioner. I received my education from Villanova University and the University of Pennsylvania. I am the nurse manager currently at Amnion Pregnancy Center located in suburban Philadelphia. And it's my pleasure to represent medical services offered at pregnancy centers all across the state. So at Amnion, where I work, the pregnancy center in Drexel Hill in Norristown, Pennsylvania, we offer STD testing and treatment, pregnancy testing, limited obstetric ultrasounds, and abortion pill reversal. Our STD testing, or STI testing, includes HIV, syphilis, tested through blood, gonorrhea, and chlamydia, tested through urine or vaginal swabs, as well as pregnancy tests, urine pregnancy tests, and limited obstetric ultrasounds to confirm pregnancy location, viability, and gestational age. Because I'm a nurse practitioner, I'm also a registered provider with Heartbeat International to provide help for women who are regretful and seeking to reverse their medical abortions. I'm also able to spend time with men and women and providing education on sexual and reproductive health. Although my scope of practice has become smaller in a pregnancy center, I made a very intentional choice to leave my mainstream health system work to come to this pregnancy center setting because I believe it's critical. Pregnancy centers that offer medical services are led by a medical director who is a board-certified physician. At Amnion, our medical director oversees and signs off on all standing orders and testing and treatment services we offer. These are reviewed annually by our director. Pregnancy centers that offer limited obstetric ultrasounds also have oversight from a radiologist. The radiologist is also a physician who reviews our ultrasounds at the end of every day and signs off on the scan that was performed by either a nurse sonographer or a registered diagnostic medical sonographer. So as you've just heard, pregnancy centers are staffed with certified medical professionals licensed through the state of Pennsylvania, ranging from physicians to registered diagnostic medical sonographers to registered nurses to nurse practitioners to phlebotomists. We follow guidelines from OSHA. We are HIPAA compliant. We carry CPR BLS certifications as any medical clinic would be expected to do. You may find it surprising, I found it surprising, that the Pennsylvania Department of Health, as well as the local county health departments around in our area, refer men and women to our clinic for STD testing and treatment, as well as pregnancy-related services. Recently, we've had women come to our clinic stating that Planned Parenthood sent them for our free ultrasound services. I bring this point up to demonstrate that the state and county health departments, as well as Planned Parenthood, are often deemed as legitimate health care for women, and they're amongst the professionals who are sending their patients to us for free services. Pregnancy centers are ready and willing to provide free services to the local community. At Amnion, we have been able to establish valuable relationships with both patients and other local medical professionals. As you could surmise, the medical professionals working in pregnancy centers are the same medical professionals who could be working in any other setting, likely earning a higher salary. Pregnancy centers are staffed by medical professionals who have decided to bring their experience and expertise to this specific setting to deliver high-quality care to men, women, and families in need. Thank you, and I'm going to turn it back over to Sarah.
As you have heard from many people, and as you see from the number of people up here today, the work of pregnancy medical clinics and resource centers is absolutely essential to many Pennsylvanians. These aren't optional services. These aren't nice things to make life easier. In many cases, these are absolutely vital to the health and well-being of families across the Commonwealth of Pennsylvania. Women depend on pregnancy medical clinics for early pregnancy diagnosis, support to make decisions regarding their pregnancies, and referrals for a range of services, including prenatal care and social services. Both women and men depend on pregnancy medical clinics for STI testing and treatment, and other services that are unique to each individual pregnancy medical center, pregnancy medical clinic, and based on the needs of the communities they serve. Families depend on pregnancy resource centers for education and material help, along with the same referrals provided by pregnancy medical clinics. As you've heard, pregnancy medical clinics play a vital role in connecting with populations that are statistically underserved by the medical community. They earn patient trust to expedite prenatal care, or if necessary, emergent care. They can make as much noise as they want, don't even worry about it. Listen, baby's gonna baby, you just have to deal with it. The Pennsylvania Pregnancy Wellness Collaborative is proud to represent pregnancy health centers, pregnancy medical clinics, and pregnancy resource centers in Pennsylvania. We know that these vital organizations are not only good, they are absolutely essential for our communities, for the Commonwealth of Pennsylvania, and for America. I would like to echo the invitation you heard earlier. Whether you love pregnancy centers, whether you've never heard of pregnancy centers, or whether you'd frankly just like us to go away, I would invite you to visit, tour, and find out what we really do, and meet the people that we really help. I promise we're not scary. We'd love to meet you, we'd love to show you around our facilities, and we'd also like to talk to you after this event. So please, if you have any questions, we'd love for you to talk with any of us that are up here, but specifically myself, Jill Hartman over here, and Amy Shearing back here. We're available to answer questions from the press. Thank you so much for your time, and have a great day.